everyone. I'm a pleasure to be here. Dr. Tycho mentioned that he's the director of your program to me a few months ago when I saw him, and I was very impressed that there's a family practice program here at Soin. It was well needed. It was a delight to know about it, and you have a wonderful director. I've known him, since he said in '84. I think he was a St. E's resident at the time, and he's had a very nice career from family practice to sports medicine, and now here. I'm delighted to be here. My daughter Christina's a fourth-year medical student at Wright State. A friend in the back, Dr. Case, is a dentist. And I'll tell you about myself. Okay, I was a Wright State graduate, first class 1980. Actually, I was the first female graduate since my name started with B, and I was the third one to graduate and a female. I did for dermatology, you have to do an internship or a transitional year. I did 1 year of family practice myself at Good Samaritan Hospital. I had a clinic, I had patients, just like you, and I went that direction. After that, there was 3 years of dermatology. I was lucky to be able to stay in Dayton since my family was here, and entered the Wright State dermatology residency. I've been in private practice, as Dr. Tycho said, since 1984, basically solo practice. I'm independent. As you're going to notice, a lot of the practices are being bought up. Even, I know family practice for sure, but the dermatologists are also being bought up by corporations. So the landscape's changing. I'm happy to still be in private practice on my own. So dermatologists specialize in 3 areas. One is the skin, which is our largest organ. Second area is the hair. We have 100,000 hairs. Unless you lose 10%, you never realize you're getting thinned. So the hairs. The third part of our specialty are the nails. I categorize what we do in 2 sections. First are office visits. So what I liked about dermatology is we do a combination of office visits and procedures or surgeries, like as you do in family practice. So the office visits would be anything like rashes or skin diseases, and the surgeries are things we can do in the office: moles, skin cancers, cysts, skin tags. We see diseases. Anything can go wrong with the skin. We get new skin cells every month, every 4 weeks, but examples like what could go wrong: psoriasis on the skin, that replicates every 7 days. Then there are diseases like bullous diseases where you get blisters on the skin. And for the skin infections, we have 3 categories. One would be bacterial infections such as impetigo, staph, strep infections. Secondly would be fungal infections like you'll see on Tinea pedis, ringworm, as in put it, onychomycosis, tinea versicolor. And the third category would be the viruses, such as herpes or shingles. Then we have lesions on the skin, and I brought some of the brochures that we have at the office. Basically, we see all of this, and we see it over and over. So if we have a resident in the office and, he didn't quite get what that rash was, maybe 2 or 3 hours later, we'd see it again. So, it's a repetition. We see basically the same things over and over. But if you're interested in any of the brochures, I have them here. Okay. Let's see. I think dermatology is like show and tell. I mean, it's almost, you might as well make it fun. The patient has something, they want to know what it is, and you tell them. And things like we also can, let me think. I think what I like to portray is how it can be fun to be in practice. Sometimes when things are unexpected, it's more fun. Like when we had a patient one time, couldn't get out of the car, so I went out in the parking lot, took off his skin tag, came back in, kind of like, Wendy's. And another time there was a fire drill when I was in the big office, and everyone had to go outside, so I brought the cryosurgery with me. We had patients, so I treated them outside. When you have patients, it's good to get to know them. I think you need to use their names, and when they tell you something like, well, I'm going on vacation, or someone's getting married, just jot it down. I don't know how you can do that with electronic medical records, since I still do on my charting by hand. But it's nice, you start to have a relationship with the patient. They become like a book. You know, you have chapters, you know them throughout their life. And it's interesting, it's fun. I remember one patient got divorced, got married again to the same person, got divorced again. You know, it's like, you know, you can't get that entertainment on TV sometimes. As family practice doctors, you're somewhat like dermatologists. You know, you have the office visits and you can do the procedures. I would suggest or encourage you to do the procedures. For one thing, it's rewarding. It's a little distraction from the other things you might be doing. And you can get paid a procedure fee either through the insurance, or if it's cosmetic, you can tell them what you want to, what you want to be paid for that. And many of the patients will appreciate that. They don't always want to go somewhere else, to be treated. Okay, so now now we can start our program. About 20 years ago, myself and a few other dermatologists created this RAISE project. You might not realize it, but people used to tan very heavily. And especially when the tanning beds came out, it was so harmful for the skin, but they promoted it as being safe, a safe way to tan. So we, a group of us, and including Betty Lacey, I should give her credit, she's in the alliance with the physicians. So when you're a physician and then the spouse can join an organization, it's called the Alliance. And she took it upon herself, and there were no materials we could use to tell the students about the hazards of tanning. So we created this. Since that time, this talk has been given to about 100,000 people in the public, mostly in this area, but it's gone also nationally, and there were sales for this. At this point, you can get a lot of materials about tanning and the hazards of the sun, but not back then. So I'm gonna now start the program and show you. You have a multi-million-dollar complex, state of the art, but I was told I had to bring my own
laser. Pointer?
Laser, yeah. And so I brought the one we use for the cat.
Like it has different shades.
Because laser pointers don't like to show up on that screen.
It's a butterfly shape. I think it's a butterfly.
Well, it can be a butterfly, or it can be a mouse. A star. But it won't show up here?
It doesn't like the
Just
screen.
point to it. Just point.
Okay.
Yeah.
All right. Now, where do I push?
Try space.
All right, so we've shown this, to high school students, elementary students, doctors at like Kettering Medical Center, the Dayton Dental Society, nursing homes, anyone who wants to see it, we've shown it. And a lot of it's basic knowledge, but that's all you need, just to be, know a few things and to be aware. For example, if you're checking someone's heart and they have atrial fib, you're not to be worried about their skin so much. But if it's right in front of you and there's a melanoma there, you just have to be aware to look around, and you're screening them. Okay, what this slide is showing, the ozone layer is thinner than it was in the 30s, so more sun is going through. And this whole thing about the tanning is an interesting story. Earlier than the 1900s, no one wanted to tan because if they were dark, it made them look like they were a worker or they were in the fields. But then 1920 came, and there was a person named Coco Chanel, and she has a good story, and it's on Netflix if you want to see it. But she started designing hats, and then she made the little black dress. Before then, all the women had the long dresses, and it was puffy, but then she had the sleek dresses, and she sent some models to the Riviera or something, and they started tanning, and then it caught on, and then people wanted to tan more and more and more, until by the time it was the 1960s, if you weren't out there tanning, and you would look out of place in the summer. If you weren't dark and as dark as you could be, you'd look out of place. And so Time magazine did a series of the worst mistakes of the century around 2000, and at the top of the list was sun tanning. So it was a mistake, and In my office, it's like a tape recorder all day long. I have people in their 70s and 80s or 60s, and they go, we didn't know it would hurt us to tan. We didn't know. I said, it's okay, you have an excuse, they didn't know. But now we do know, and, we don't want sun damage and skin cancers. Okay, so, reasons, people spend more time outside, used to be a healthy tan was what it was thought of, skimpier clothes, all of this. We can read that. So we know now that you can get skin cancers from the sun, and how it goes. There's just basically 3 skin cancers to know about: basal, squamous, and melanoma. So this is the skin layers with the squamous layer, the epidermis, then the second layer, and then the third layer. If the cancer's in the squamous cell, it's called a squamous cell cancer. If it's from the melanocyte, it's a melanoma. Basal cell would be basal cell. At the first layer, if it's just dry and pink and scaly, it's precancerous. And then if the cancer fills up the first whole layer, then it's carcinoma in situ. If the cancer drops into the second layer, then it's squamous cell cancer. And 1 person every hour dies of melanoma in our country. And so as we're speaking here, 1 will die. And no one dies of basal cells. And squamous cells, there are deaths from squamouses too. Okay, I have 2 twin sister-in-laws. One lives in California, one was in Rhode Island. And by the time they were 35, you could see the difference in their skin. It's not these 2, but the point is, wrinkles are both from genetics and the sun exposure. So we can't change the genetics, but the sun exposure can make a difference. And people don't just look older from wrinkles. They look older if they have the brown sunspots, which they call age spots. I call them new age spots, so they don't feel badly. But so it's a whole thing. Okay, so I guess it's obvious, the lighter your skin is, the more likely you'll have skin cancer or sun damage. And the darker your skin is, the more protection you have already. It's like you already have a sunscreen on. So here's the lightest to darkest skin. There's a Fitzpatrick categories of the light to the dark skin. I met this Dr. Fitzpatrick that actually made up the categories. He was at Boston. He's long deceased, but the Fitzpatrick categories, 1 to 6, lightest to darkest. This person really cannot tan, redhead or blonde. They are either red or white. And then this person is still sensitive but can tan. Then we get to the more average tones, and then the olive, and then the darker skin. And so at this point, I like to think about the world. So where do the lightest persons live? Like northern Europe. And the olive people are in the equator or the Mediterranean, and then the darker people down where there's more sun in Africa. So that's all genetics and evolution. So where is the highest, here's the question, where is the highest level of melanoma in the world? Which country has the most melanomas per capita? And then the second part is why. If you know the answer, don't. Well, you don't even know it?
Okay, maybe I do. I don't know.
What is it?
I'd say Australia.
Australia's the answer.
Okay.
Okay, now why?
It's
There's-
really hot there.
Exactly. So I guess around 1600, they would send the prisoners from Northern Europe to Australia. They would deport them. And that light skin shouldn't be down there. It should be Aborigines. And Australians, years ago, they were on top of it before the U.S. And they had a law that they could not have a model who was tan. So if you have a magazine cover and a model or actress, they wouldn't show them if they were tan.
That's awesome.
Okay, these are the actinic keratoses, actinic meaning sun, precancerous because they can turn into squamous cell cancers. So we freeze them. I think you have nitrogen too, Dr. Taco showed me your nice facilities. I put it in the canister every day and freeze it out. Here's the trivia question. Who knows, well you know what's in here? Okay, who knows the temperature of nitrogen? This was on Jeopardy.
It's 272.
Okay, 300 is close. Are you talking
272.
about centigrade or Fahrenheit?
That's
Fahrenheit.
Fahrenheit.
Yeah,
We're all like,
I
oh gosh. He answered. He answered.
Does Dr. Tycho know?
272, minus 272.
Okay, it's close. It's 320 Fahrenheit minus, and centigrade was at 178. Okay, thank you, Jimmy. He just looked at that before we came in. Okay, and it's number 7 on the periodic table. Is that right? Okay. At the end, we're gonna put the nitrogen in a cup and put fruit in it and throw it, and then it will break like this. So you're able to freeze them, and also with this, you would be able to freeze your warts. And do you know what seborrheic keratoses are?
Like, yeah, maturity spots.
What is it called?
We call them maturity spots.
Okay.
That's our colloquial way of.
They're commonly known as barnacles. They're commonly known as barnacles. So I just call them barnacles now on occasion. But you could use that for the barnacles, and that's a cosmetic removal for most of the time. But if they're irritated, they'll go for insurance. The 3 skin cancers I mentioned. A lot of women get melanomas in their late 20s, and we're calling that maybe attributed to tanning beds. And so one time I went to Christina's class at Oakwood and spoke to the class. I said, how many in here have gone to a tanning bed? And it was a 10th grade gym class, and some people started to raise their hand. And the teacher actually said, ask how many have not gone. And then about 5 or 6 people raised their hand. The rest of the class were going to tanning beds, very commonly. So you know the parts of melanoma. I mean, I feel like you know some of this. They call it ABCD, asymmetric, irregular border, color black or various colors. The fear is sometimes they can be red melanomas, and that would be by surprise when the biopsy comes. But usually it's going to look like this. Diameter, they say more than 6 millimeters, but they can be less than 6 millimeters. And E means, now they have E, changing, evolving, growing. That could also be a sign of melanoma. Yeah, that fits, that's, melanoma. Okay, the reason this person, she has a melanoma on her left cheek. Betty Lacey, who helped make this was her sister. So they caught the melanoma on her left cheek. You might think it's a beauty mark. And then that was after her surgery. The basal cells, believe it or not, I mean, they're common. I see about 3 a day and take those off in my practice. And they're considered pink, translucent papules, but that's just a classical statement. If you see the basal cell on the back or chest or arms or legs, many times it's just a flat pink patch. And, it could be mistaken for eczema or psoriasis. This is the classical picture, often on the face. And these pictures are from the area doctors that made the slide presentation. The eye's not good if it's there. Oh, so basal cells destroy the skin. They don't metastasize, but they'll destroy the skin. The squamouses they're coming from the precancers, and they're more crusted. They are not destructive, but they can metastasize. about the tanning bed. Tanning beds are UVA rays. The sun that burns you is UVB. And so they started to say A doesn't hurt you because you're not really burning, but it's going down intensely. So it is very harmful. And by the time the patient realizes it, the damage is done. And now they're coming with all these problems. Oh, they can say it's addictive too, and I've talked to people, they're addicted to the tanning beds. They'll go 5 or 6 times a week for years, and they just feel good. It does something to the serotonin levels. Oh, now what's happening is there's an awareness that the tanning isn't so good, and they still want to look tan for dances, so they'll have the spray tan, which we feel is safe. You can have a spray tan at the tanning bed salon. There are some drugs that react to the sun. It's called photoallergy. Some of the medications like hydrochlorothiazide. The patient's not allergic to that. They're not allergic to the sun, but together they'll get a severe burn, severe reaction. Tetracyclines are another one. It doesn't happen to everyone, but it could be 1 out of 100 will get the photoallergy. Okay, so just some common sense things. If you can go golfing at 5 instead of noon, that would be preferable, or earlier than 10. Just try to avoid the peak hours. Oh, does anyone recognize this one? That was my model. Christina helped. Kids can check their skin too, and there have been at least one case of a melanoma that a student found after seeing the slide presentation. Look between her toes. You put the sunscreens on. They say 15 minutes before you're out. Repeat it after 3 hours. And that's Christina and her father there at a younger age. So wearing sunglasses, because the sun can affect cataracts too. It's interesting, if you see farmers or people in Mexico, they're fully covered, even in the hot sun. The hat's important for men. The men get a lot of skin cancers on their ears, and it's because the hair doesn't cover their ears. And the hats they use might be a ball cap. So it's just a point to think about, where sunscreen's there on your ears. So you can enjoy the sun as long as you take precautions. Okay, okay. What would you think this is? Basil.
Oh,
And I think this was my brother's slide, my brother Ron, who's the eye doctor. I believe it is. See if you like that first comic. Can you get the first comic?
It's correct.
Do you understand the first comic?
Yeah.
Okay. And then the second one is obvious. Okay, we put a couple extra slides in on other topics. The herpes, if it's above the waist, it's called herpes 1. If it's below the waist, it's called herpes 2. That's the fever blisters. The staph infections, impetigo, I think a lot of times impetigo isn't diagnosed early enough. Sometimes it's not recognized by other specialties. So if you see the crusting, if you see these open oozes, you need to give them an antibiotic. The ringworm is not really a worm, but it's round and it's a fungus, and then they call it ringworm. But On the body, tinea corpora, the foot, tinea pedis, the hand, tinea manum, the face, tinea fascia, the groin, tinea cruris, so just, different locations. When it's on the scalp, you have to use, they still use griseofulvin for that one. Tinea versicolor is another fungus. It comes often in the summer. It comes in people who are sweaty. They get these pink, whitish, dry spots. And for some reason, they'll get it again the next summer. They're just prone to it. This was always a board question. The look of the tinea versicolor looks like spaghetti and meatballs. And that's under the microscope, the KOH exam. Here's the fungus on the toenails. Scabies, they say, is hard to diagnose but easy to treat. So it might take a month or two. The patient might go from doctor to doctor. But once the scraping is done and it's identified under the microscope with either the egg, the scabies, or the feces, it's easy to treat. And you should treat the whole family because it bounces off from one to the other. It takes a month to get it, from the exposure to the time it shows up. Atopic dermatitis is eczema, dry, chapped skin. I think that was it for the main program. Are there any questions?
Kind of different topic, but just always a tough one. I was curious how you approach it is onychomycosis, so like toenail fungus.
Yes.
You know, I feel like we always read that the only effective thing is orals, but then everyone's worried about liver. I mean, is it worth it? What do you find you normally doing for it?
Well, you really have to take oral medicines. They have a couple. They sold Caridim and there's Jublia. They were about $1,000 for 5 milliliters, and it didn't even really work. And it was topical. You really, if you take terbinafine, which is the Lamisol brand, it's safe. We say just make sure the person has a normal liver, and if you're not sure, take a liver enzyme test. But it's safe. Previously, before that came out, it was griseofulvin, which was more harmful for the liver, and the patients had to take 2 or 3 pills a day, anywhere from a year to a year and a half, till it grew out. But with the terbinafine, it's a 3-month prescription, and then it stays in the nail as the nail's growing out for the next 9 months. It's safe.
So a lot of people are still nervous about it, but you're saying you haven't had any problems with terbinafine orally?
No, I mean, I think I've seen someone get allergic to it, and a couple people have lost their taste, because that's a possible side effect, but it comes back. And the sooner you treat the toenail fungus, the better. I mean, if you're a young person that's on a couple toenails, you should treat it. But if someone's 75 or 80 and all 10 toenails are yellow and thick, it's not gonna be 100% cured. It might not be worth it at that point. It's more difficult to treat it when it's been there many years. But I find a lot of podiatrists don't treat it either. It's interesting. They're afraid of it, but it's so much safer than the griseofulvin. When Lamisol came out, it created the industry, because before then, no one was really treating fungus on the toenails much. And they said, well, here, you can have a brochure. So I put a brochure in each room, toenail fungus, Lamisol. It got to be so burdensome that we took the brochures down, because they're there for another purpose, you know, but all of a sudden, oh yeah, I have toenail fungus, or my brother has it, or, you know, let's talk about this, and, you know, we weren't able to keep the brochures up. Then it became generic. When it first came out, it was about $800 a month, and we had to do a KOH or culture, or the insurances wouldn't cover it. Right now, it's practically free. We were able to get it for like $10 or $15 for 3 months at Walmart at one point. Kroger's still pretty low, but it's gone way down in price. Oh, this is my office. Took a picture this morning. Yeah, and I call it Dr. Seuss instead of Dr. Borchers with all those colors. But we enjoy it. Okay, now do you want to, if you didn't think dermatology was superficial before, this will confirm it. We'll put on our outfit, and here's the liquid nitrogen. So again, use it for warts, use it for precancers, use it for barnacles or subreactive, even liver spots will come off with this. And I'm gonna have to open it. So this tank lasts me all day, and we just fill it up each day. I know you have a different kind of tank. Okay, you never know how this is gonna go, but we'll put the nitrogen and the styrofoam cups. And when I have a patient, a little boy or baby or girl crying, I'll let them play with this after we freeze the wart. We let them pour it on the ground and make a puff.
I felt that.
So we can put a grate in. Oh, and if you take this and put water in it, you will have instant ice in a few seconds. And one time we talked to the Girl Scout troop, and I had a recipe for ice cream. So when we were finished, we had the ingredients, the cream, and we put the nitrogen in, made the ice cream, and then everybody had a little cup of ice cream when we were finished. So there's a recipe with the ice cream and the liquid nitrogen.
So cool.
So you wouldn't want to touch it. I brought
She's prepared.
So, okay, if you don't mind, I'm just gonna try to break it.
On their new team.
Oh, wow. I found it.
Now here's the strawberry.
Strawberries are good.
You should let them break it.
Okay, let them, maybe the boys or the strong people.
No, that's not me, man. Looks can be deceiving. Yeah. Look at those guns.
Does anyone want to try to?
Starting to smell it.
Sure.
It's have a smell.
Do it, bring it. Okay, do you want to pick up a grape with?
Careful.
Good.
Looking at a science game.
Ready?
No.
Oh!
Get out of my face.
Try again.
I gotta go pick it up.
You probably have to hit it on something
Oh,
hard.
yes.
You can do it.
Quickly.
Believe
I don't mind
it.
trying.
Okay. Can you go that way? I'll move this too. Even distribution?
All about
distribution there. You want someone back there to try strawberry or?
Probably ice cream.
Take out one of them and just hit it on the desk.
You should tell them about what they are.
Candy takes out her anger.
I'm so scared of it.
She did.
You should tell them oh, I use this for this or this or that.
I just want to show you my card that Christina surprised me with. On the back it says, if you see a spot, see Dr. Borchers. So, anyway, come up here and if you want to take some products, that's why I brought them. Just have fun.
You can give preference to
Thank you for having me.
Thank you.
You're welcome.
Thank you so much.
Yeah, sure. Oh,
What's a skin bar?
I know I'm about to be all over the but there must be here in the
I'll take everything else.
They have a
go to travel things.
You kinda act like it.
My husband
Actually,
is
more
Bob.
about-
I think he I can share that one.
So, like 100 doesn't matter.
No, it's not significant.
Is it stuff
Because I wonder.
And how often should they put it on if they're gonna be?
Pre-clears.
What about like water?
This is swimming.
You need it.
I think that I want that.
I trust you in your opinion.
Water resistant.
It's like, put this in.
Oh, I forgot to tell you.
Liquid sensor.
Especially because we're about to get to winter time. This is not my
Can you guys do that brochure on skincare?
Sort of. He's
Samples?
samples.
Wow, that smells good.
I think she did.